Welcome back to the Neurology Minute. I'm Rogan Magee, and you're learning about how the pen and paper can augment your exam of patients with tremor. Essential tremor is defined by an action tremor in both arms. The pathologic mechanism is incompletely understood, but may relate to an increase in rhythmic activity in a large circuit involving cerebellum, cortex, and thalamus. In looking at spirals drawn by patients with ET, the tremor often manifests as spirals of relatively normal and consistent size, but with mild amplitude, high-frequency oscillations along an axis in one direction. To look for an axis, look and see if the oscillations are most notable in certain regions of the spiral. A helpful way to think about this is to imagine the spiral as a clock face. If the oscillations are most notable in the sections of 2 o'clock and 8 o'clock, then that spiral's axis runs from 2 to 8. In ET, a right-handed spiral will have an axis from 8 to 2 o'clock, and a left-handed spiral will have an axis from 10 to 4. Dystonia involves co-contraction of agonist-antagonist muscle groups, often leading to a tremor that is exacerbated under specific conditions, like postures. On paper, dystonic tremor occurs along multiple axes, resulting in variable amplitude but consistent frequency oscillations throughout the entirety of the spiral drawing. In this way, axis can help separate dystonic from essential tremor. Spirals here are again regular in size. Parkinsonian spirals have their own features. The examination hallmark of Parkinsonism is bradykinesia, which manifests in spiral drawing as smaller size and a higher density of turns of the spiral. Some have referred to this as increased tightness of the spirals, as the sequential loops are closer and closer together with each turn. In Parkinson's, spirals may also oscillate along a single axis, as in essential tremor, but the size and density of turns provide specificity in separating Parkinsonian tremor from ET. Functional tremors produce the most variable spirals. Oscillations may vary in amplitude and frequency within individual spirals, and/or change in amplitude and frequency between dominant and non-dominant hands. Oscillations introduced by functional tremor may also vary across tasks, becoming more pronounced in the straight-line task as compared to the spiral. Together, these clues provide valuable evidence in separating tremors with varied causes and markedly different treatments. Join me in the next episode to learn how adopting new and exciting technologies may elevate the simple hand-drawn spiral to new heights.